In this video, we will cover one of the diagnostic tools for pelvic organ prolapse. We will be looking at 3 screenings, which include lumbosacral dermatomes, reflexes, and myotomes. First, we will cover dermatomes. We will be looking at Jordan's L1 through S2 dermatomes. Her L1 dermatome is located right at the underwear line, so we will not be testing that in this video. The L2 dermatome is located on the medial anterior thigh. We would have the patient close their eyes. We're going to administer the swipe using a soft touch, such as a tissue or a cotton swab. We would administer the swipe and ask the patient if it feels the same or different on each side. L3, we are looking at the medial femoral condyle, and we would administer a swipe, ask the patient if it feels the same or different. L4, we are looking at the medial malleoli. L5, we are looking between the first toe, the great toe, and the second toe. S1, we are looking at the lateral malleoli. And S2, we are looking in the popliteal fossa. So she has passed her dermatome screening. We are going to move on to testing the reflexes. The first reflex we will look at is her patellar reflex. So we're going to palpate for the patient's patellar tendon and then administer the reflex hammer, and she shows a normal reflexive response. The next reflex we are going to look at is her Achilles tendon reflex. We are going to put the foot into dorsiflexion and apply the stimulus to the Achilles tendon at the back of the heel. And her foot plantar flexes with the stimulus, showing that she has a normal reflex. The next set of screening we will look at is her myotomes. So we are going to lower the table so that her feet are flat on the ground for optimal strength. We will look at her L2 through S2 myotomes, and we are looking for the patient to be able to hold an isometric contraction for 5 seconds. We would test reflexes and myotomes bilaterally, but for the sake of this video, we are testing unilaterally. I'm going to look at hip flexion, so we'll have her bring her knee all the way up. Great job. And then we'll have her come all the way back down, come up halfway, and then apply force for 5 seconds. She can sustain it. L3, we are looking at knee extension. So she's going to extend her knee all the way back down, and then extend, or she'll stay here. I'll apply force. She can sustain it for 5 seconds. Next, look at dorsiflexion. I'll have her bring her toes up to the sky. Great job. All the way back down, and then halfway up. And then I would apply force. She can sustain it for 5 seconds. The next myotome we will look at is great toe. She will extend her great toe all the way back down. I'll apply force. She can hold it for 5 seconds. The next myotome we're looking at is S1. For S1, we will have the patient stand up and go into a calf raise and sustain that for 5 seconds. Perfect. She can sit back down. For the final myotome, we are looking at S2, which is knee flexion. So we would have the patient flex their knee, perfect. And then I would apply force, and she would sustain it for 5 seconds. In this screening, Jordan has not shown any abnormalities. However, if you see abnormalities, then you would do further neurological screening for that patient.
Nerve reflex, which is the bulbocavernous reflex. This is done by gently tapping or squeezing the clitoris. You could also look at the anocutaneous reflex, which is also referred to as the anal wink sign, which can be triggered by stroking the skin surrounding the anus. With both of these reflexes, you would see a reflexive contraction of the anus. This reflex indicates an intact S2 to S4 spinal reflex arc and gives us important prognostic information about bowel, bladder, and sexual function.